licenses at both the golf courses. Any discussion on that? Any questions? Okay, that brings us to the personal service contracts, and unless there's some major issue, I thought maybe we could handle these items as a consent agenda and just clump them all together.
I just got a few questions, though. I don't have a problem with that tomorrow, but I do have a few questions.
Go ahead.
Basically, we have a controller just for the golf courses themselves?
We do.
Okay, so our budget and finance doesn't handle that, or?
It does not.
Okay.
And they do other things as well as just the controllers. They count monies, they can work in different areas as well, expedite food.
Okay.
We use that term, but they do a lot of different administrative functions other than, and as well as controllership.
Okay. Now, do you run each golf course as a separate entity or two?
Well, they have their separate, both properties have separate staff.
Yeah.
And they're open in the mid-season from 5:30 a.m. till 11 or 12 at night, depending on the number of people.
Mm-hmm.
So the reason that if you might look and see that there's a significant amount of management, you have to have management there to run these $740 an hour seasonal help people. And that's kind of the idea. These are just the management team. Everyone past these people's contract listed are purely hourly seasonal people.
So it's enough work to where the manager of one golf course
can't
manage
you've got
two.
leagues, you've got outings, you've got corporate events.
Okay.
Absolutely.
I had a question. I know that for the controller for the meadows and the lakes, it was the same person in the paperwork.
That's not true.
That's
Yeah.
not true.
No.
Okay, because I
No,
guess it's just
and let's talk even about that. The Meadows controller is actually split. I split that position between TSX and Taylor Meadows. So they're splitting those hours. In the busy season, they're over at TSX. In the busy season for golf, they're at golf.
Okay, so
Because the two
an issue with the paperwork at the end here.
Okay.
Okay.
Yes, we're the same here.
Okay.
Question, so these are complete full-time employees?
They are complete full-time employees. Now, how are you defining full-time, Councilman?
2,080 hours.
No. Some will work 1,900, some will work 2,000, some will work 1,880. They're broken down, but they don't work 40 hours a week, 52 hours a year. They're seasonal management. They're not overtime. All hours are straight time, and they can work 70, 80 hours in some weeks when we're really busy. And then in the winter time, in January and February, they can work 15 to 25 hours, depending on what.
But they're there.
They're there 12 months of the year, but their hours are not 12 months.
And they always got benefits, these type of?
These positions have. Before personal service contracts, they were letters of employment.
Okay. And then the payment in lieu of?
Correct?
I noticed the one, I'm not trying to single out anybody, I don't want to mention the name, but they're actually a city employee. They're spouses, so they can get that also?
This person that's on your schedule, because I have a copy of the schedule, I was forwarded the same. This person's spouse is not an employee of the city.
No, there is one.
Yeah.
There's one.
Right now, currently? This
Because
is
I thought-
Meadows Operations Manager.
No, other side, lakes.
Lakes?
There's nobody getting, because my question is, I thought,
Lakes don't have any names on the schedule for me, sure.
if I remember right, that in 1128 contract,
Okay.
if you had, spouses working, they couldn't get
I see.
payment in lieu of.
You don't see anybody getting to that rate, so.
Who is
Is that
that
what you're
lady?
saying?
Amber?
She
You're talking about the sheet that I sent out
Yep,
today?
yep,
Yeah. The controller under Lakes
yep.
is the person, the position that we're talking about. She is not currently receiving any benefits because she's covered under her spouse.
Okay.
But she is, but
In this contract, she will become eligible.
Well, she's not.
She will not become eligible because she's receiving a
in the
benefit from the
contract,
city.
so she says they would get it.
She could not get payment in lieu because we're already paying for
Right.
health care
I
coverage.
think the contract says she can if there's a spouse, though. And she's not getting it now either.
Okay.
Now, I I had questions about payment in lieu, and I've been asking them for a couple of months now, whether or not philosophically, not just golf course employees, but philosophically, if the city is still getting a bang for its buck by offering payment in lieu, is that something that we should still be doing? Are we really saving money? You know, when I look at somebody who's gonna have to pay 35% of the cost of a policy, if they don't need it, are they really going to choose to take something that they don't need to pay 35% of the cost?
Well, I mean, to answer your question, I think philosophically, I don't disagree. I mean, undoing it may be a bit of a challenge. You know, this may be a little bit different, but through negotiations, you know, many of those are not going to willingly, you know, give up that benefit. So it could be challenging to get rid of it. You know, again, I don't disagree philosophically that I think we're reaching that threshold that we should be looking at it, but I think it's going to be a little bit of a bigger process than, you know.
No, I understand. I didn't want to make the accountability to golf course employees. I've been, you know, I asked about this in November, and I don't remember the figure that you gave all of council on what we spend annually, something like $200,000 or $250,000, and if that was really initiated 5, 10, 20 years ago as a cost savings measure, and it's no longer saving cost, it seems like a likely thing to at least discuss and try and eliminate, because I'd rather see us spend that 200 grand on people or capital or put something other than giving it to someone who doesn't really need the incentive not to take it anymore anyways.
My guess is the only way to fix it, I guess, you know, just strategically thinking, is that it would have to be somehow incorporated in as a salary. Many of these people have become dependent on this as a part of their salary, of their cost of living. And then it would be a little bit of a slippery slope if you did that, because then they would technically still be eligible for the benefit if they needed it. So they, you know, I mean, so let's just say in theory, instead of paying them $4,000 a year, you just increase their salary by $4,000 and assume that they didn't need it, but at some point if they did, then they would still be eligible. So it kind of creates a...
I understand. I'm just talking about a strategy from, you know, not just the city of Taylor, but employers all across the country. 15 years ago, everybody was doing this. It made sense. You were saving money when insurance was free, but it's not free for anybody anymore. So most people have done away with the incentive because it doesn't do what it was intended to do, which is save money.
Well, and in this case, it's a higher percentage than most because it's 35% as opposed to 20%.
Now, in looking at the list that we got from HR, there's only one employee. So again, I wasn't thinking about this to impact that one person. I'm just saying across the board, $200,000 is a lot of money to pay people to not do something that they probably wouldn't take anyways.
Yeah. I know in the state, we just got our contract, and they reduced it from like 400 down to 200. So it's slowly going away.
What I was wondering, is this a reduction too from other contracts, the amounts in these contracts?
For payment in lieu?
Yeah.
No, it exactly mirrors the other contracts.
Yeah,
I thought it was 150, 300, and 400.
Yeah.
And isn't this?
This is,
This is
yeah.
150, 200, and 300, so this is
Oh, in that contract.
in these golf
Okay.
contracts. I didn't know if we were reducing it citywide as we negotiate.
In theory, I'd love to see that gone away. I mean, in theory, I don't disagree one bit, but, you know, the difficulty is developing the strategic plan to, you know, negotiate that out.
Is our seasonal golf workers unionized? No? Okay.
No, that's why they're on a personal service
Right.
contract, yes, that's their employment agreement.
I think there's gonna be some trends also as, you know, more layers of affordable health care roll out. I think you're gonna see things evolve differently. I mean, in the past, it was great to have secondary coverage, and I think that's gonna go away, because I think there's gonna be limits in terms of what providers are gonna accept. In some cases, secondary coverage is not a good thing and can be very confusing when a person has secondary coverage. I think in terms of what we will have to offer as an employer will evolve. There's things rolling out in 16 and in 18 that are going to change the whole view of how we're offering, you know, medical benefits. We're just not there yet. So I think, you know, I concur with the mayor that I think over time, it's something that we're gonna look at and continue to, you know, strive to mirror with where, you know, federal policy is going, and just, you know, take little bits at it, because there isn't just one way to turn the switch off and turn it back on. It's gonna take some time.
I looked at these costs, the figures listed here for medical. I'll assume that some people that are a family of four, some are two, and some are single. Is that annual cost true if you're 1128 or 1917? Is it the same for every city employee? Are those accurate
The
costs?
tiered structure?
Yeah. Or
Yeah.
are those numbers?
Yes.
I mean, a family of four is about $9,600 a year for the city.
Well, keep in mind, there's a different percentage, there's a different cost share. There's a 35% cost share
So
versus a
that's-
20%.
You're listing their cost, not the overall
This is the
cost.
city's cost.
But to answer your question, Councilman, there are several plans in the city, and those costs do vary.
I was just trying to get an average. On average, a family of four, the city spends 15 grand,
And
two
what's a
is 10,
monthly,
and a
just a
single
monthly
is...
guess? Couple $1,000s a month?
It's anywhere from like the 1,200 range, some plans are down to 1,000, you know, it varies. High end would be 1,400, but there's very few of those left.
Just for the medical,
Right.
correct?
That's-
Not for the